Good afternoon, everybody. Thanks for making time to make sure that you joined us today for a great training brought to us by one of our lovely colleagues in the Center for Public Health Innovation. So I'm just here to introduce her, and then she'll get the training going. I'm going to introduce Mariah Treese, who is our health literacy coordinator here at Columbus Public Health. And today she's going to talk a little bit about health literacy, talk about TeachBack, and other things that are important for the work that we do. Again, things that we already do, but it's always a good thing to make sure we practice those skills. So with no further ado, Mariah.
Thank you. Hello, everyone. My name is Mariah Treese. I'm the Health Literacy Coordinator here at Columbus Public Health. Today, we are going to go over health literacy with a specific focus on plain language and TeachBack. For our agenda today, we're going to have a little bit of a health literacy overview. So speaking about what's important about health literacy, why it's important, and why we should include health literacy best practices in our day-to-day work. We're going to see health literacy in actions through video. We're going to go over TeachBack fundamentals and examples, and then we're going to practice TeachBack at the end. So I will ask for volunteers at the end of the session to do a little role play. Our objectives for today are for you to be able to describe health literacy and its importance in your work, to discuss how to apply health equity concepts to your work, explain the TeachBack method, including when, why, and how to use this technique, and describe at least 2 plain language principles to more effectively communicate ideas. So we're going to get right into it. So our health literacy overview. Why do we even bother with health literacy? So we're going to pose a question. Which of the following is the strongest predictor of an individual's health status? We have A, age, B, income, C, literacy skills, D, employment status, E, education level, and F, racial or ethnic group. You can just shout out. What do you think? Yes, all of them are indicators, but which is the top strongest indicator? C. A. Age, okay. It is actually literacy skills. So, when we're talking about health literacy, we are talking directly about people's health, because if the lower the health literacy skills you have, the worse health outcomes typically are applied to that. So, what is health literacy in general? The New Healthy People 2030 health literacy definitions break it down into 2 different parts. So we have our personal health literacy, which is the degree to which individuals have the ability to find, understand, and use health information and services to inform health-related decisions and actions for themselves and others. So this includes your caregivers as well, your parents, your elderly caregivers. That all falls in that personal health literacy bucket. Then we have organizational health literacy, which is what we're focusing on today because we are a public health organization, and it's important that our information is able to be understood by the clients we have and the general public. So that is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform those health-related decisions. So both of those together represent the whole idea of health literacy. So at Columbus Public Health, it's our duty to be able to make sure our health information, the materials we use, the way we speak to people, is done in a way that communicates clearly and that they can understand to make those good health decisions. So why is this so important? According to the National Assessment of Adult Health Literacy, again, this is from 2003. They have done this study again and have found the same results, so that's why we use this one specifically. It breaks it down into 4 categories for health literacy. So below basic, which is generally you're able to identify your appointment time. So if you have it written down, a card, you can identify it, you know what time to get there. Basic would be knowing why you should get certain health screenings, even if you don't have the symptoms for that disease, knowing why you should get that. Intermediate would be being able to read your drug information and being able to take it correctly and on time, with food, without food, being able to read that and understand it and follow it correctly. And then proficient would be knowing pretty much all of your health insurance information. You're able to know who to call, what to call, how to advocate for yourself, and know what your coverage does before you get that bill in the mail. So in our population of the US adult health literacy, 35% of our population is below basic or basic. So it's a pretty decent amount. Most of the category falls into intermediate. I'd even consider myself in this intermediate category because once we get into that insurance detail, that's just not for me, and I'm not always the best advocate for myself as well. So that's where I would put myself, and that's where the majority of adults fall. And only 12%, or around 10% if we're rounding down, are proficient in health literacy. And being proficient means that you are able to 100% navigate the healthcare system. So you have the best health outcomes. Is this surprising to anyone within the audience? Yeah, absolutely. And I'd even say now, after with the pandemic and other factors within our country, this could even be lower. So I'm sure, how many of you have seen a chart like this here at Columbus Public Health? Yes. The upside down T. So this shows us health literacy in Franklin County, and you're going to see those same health outcomes even within health literacy as well. You see our backwards T. I have a question though, because if only 12% of US adults are proficient, why is there so much green? We can see this on political maps as well. It's because our population is not very high in those areas. So you're making it seem like it'd probably be a better option to have you ever seen the circle maps where the bigger circle shows bigger population? It'd be similar. So those little green areas would be small little dots within a bigger population. What else falls like this? What health disparities do we see within the Columbus area that also falls within this upside down T? Infant mortality. What else? Overdose. Anything else? What was chronic diseases? Yes, absolutely. Yes, so you, yeah.
It looks like the big Olympics, it looks like most of the dark parts are in the inner city. Is that right? In terms of the
Yeah, there are a lot of reasons, and we're going to get into that. So we. Yeah, we have different, well actually, perfect. Who's at risk? And this will explain that. So we know that upside down T, typically we are looking at different education levels, poverty levels, different immigration statuses. So, for example, we have, let's see, recent refugees and immigrants. Why might they be more at risk? And this is also just a disclaimer. This does not mean you will have low health literacy if you fall in one or more of these categories. It's just a higher risk of having lower health literacy. So why might a recent refugee or immigrant might not have the highest level of health literacy? English as a second language? Yep, language barrier, absolutely. Also, they're coming into a whole new system. Right? Their healthcare system back and their country of origin could be completely different than ours, and they might not have any idea how to navigate that system or how it works or how to get insurance, things of that nature. We also have limited education. Again, if you're not already seeing the value of being literacy in general and things, or don't have the same opportunities as other people to have higher literacy skills, you're going to be at risk for lower health literacy. Low income. Why might low income be a risk factor?
Well, there's a great association between low income and educational status for schools. It's all interrelated.
Absolutely. Yes, it's all interconnected. Yes. So, and you also have the stress of just the bill, right? So you might not even be thinking as your health as a priority versus the money that you're going to have to spend. So you might not even take the time to read through certain things when you have that stress as well. And then we also have racial and ethnic minorities. This is historical. We're talking about redlining, different policies that have been put in place that discriminate against certain groups of people. And that you can see that within our neighborhoods. That's also why we have that upside down T specifically in Columbus. We have health insurance status. Obviously, if you were to have no health insurance or public health insurance, that can make it a lot more difficult to navigate the system and again have that stress of costs. And then if you're not a non-English speaker, that obviously makes it so much more difficult to get through, especially if things aren't translated, or a lot of times our folks might not be very proficient in reading in their original language, their first language. So what does this lead to? Low health literacy leads to poor health outcomes. So you're less likely to engage in healthy behaviors. You're less likely to seek out that preventative care. You're less likely to have that personal knowledge about different diseases that could impact you, or even potentially family lineage that could have certain diseases along with it. You're less likely to understand the treatment options that are available, especially if you have a provider who might not give you all the options, right? So as we've seen, not to say that we are like that because we're great here, but sometimes they don't have all the options, and sometimes we have biases that we have to deal with, so they're not always thinking about the nuances of what you need. So what could less healthy behavior, preventative care, less knowledge, less understanding of treatment, what does that lead to? Well, it can lead to more medication mistakes, misunderstanding labels. One of our groups that was more prone to lower health literacy were our elderly folks, 65 and up. You have a lot of medications depending on what's going on, and that can easily get switched up if you're not on top of it. You have greater use of emergency care. When we're not seeking that preventative care and that general practitioner annual visits, you're going to see a lot more use of that emergency room. Or people might not know what their symptoms will lead to and just let it get worse and worse and worse, which leads to the excess hospitalizations. Yeah, cultural mistrust, absolutely. There is a huge distrust in the system, especially among minority groups, specifically African American or Black communities. There have definitely been trials like the Tuskegee trial that essentially it was a syphilis experiment. If you didn't know, they used Black men. They were telling them they were treating them when they weren't. They just wanted to see what syphilis would look like in end stages. So when you have those events in that history, and it's a long history, that's just one example of many things that have been done, they're not going to trust you. Why would they? So a part of health literacy is building that trust, because we need to speak clearly and have people understand and know exactly what they're doing, exactly what it does, and so they can essentially consent fully to that.
So where does access to affordable health care fall? A lot of times, in the city, they don't have access to affordable health care. What category does that fall in with that access?
Out of these specifically? I think that's a also very nuanced question. Like, it falls under policy, obviously, because we don't have like a universal healthcare system. We have privatized healthcare, and our public healthcare is being defunded as we speak. So that we're going to see a huge impact, and that is also going to impact these outcomes. So in general, I think overall, like policy-wise, that's typically where that bucket will fall. And also from a health literacy standpoint, when you make things more complicated to get that care, you're going to see that access lower. So, and also, I guess also with that piece, like when policies come out, people don't necessarily understand them. And that's why it's easy to maybe, without getting too political, go against your own interest in certain ways. So until the thing happens and then they feel it in the pocket, it's harder to go against these policies, right? You don't have the same outrage that may prevent some of those policies from going into place. I'm sorry, I know that's kind of like did that answer somewhat of your question? Because it falls under low income, access to health insurance, those nature questions mostly. But it can also impact other parts of depending on your state that you live in, how much they give funding towards public health insurance and stuff. I know with Ohio, we match certain federal spending, and if that gets cut, then we're gonna see a huge decrease in people having access to that, and then a decrease in the health literacy. All right, so with that overview, we're going to see health literacy in action. We're gonna talk about a shame-free environment and how to create that and why it's important to have that within your facilities. We're gonna talk about health literacy universal precautions, and then we're gonna talk about interpersonal communication through plain language and teach back. So our first video, we're gonna see a traditional approach that you might have experienced at your doctor or other appointment that you may have had. And then we're gonna go over what we saw at the end. And specifically in this video, we are gonna see a minor patient with his father and a general practitioner talking about asthma.
So Mac, you have something that we call exercise-induced asthma. That's when you get inflammation down in the lungs, causes bronchospasm, and that's why it's hard for you to breathe when you're doing exercises like swimming, gym class, that sort of thing. Luckily, we got something here that's gonna fix you right up and get you back on the way. Any questions?
No.
So I'm gonna send down to the pharmacy 2 things, one an inhaler, one a spacer. What you're gonna do is pop off the lid here, pop it into the spacer. You're gonna give yourself 2 puffs through the spacer, do it about 15 minutes before exercise, and then you should be good to go. Any questions?
No.
All right, well, that's great. So if you have any questions, you can give our office a call. Otherwise, we'll see you next year.
All right, and we're gonna see the reactions first. So I think you probably already know what the reaction will be, but we'll take a look.
What did she just say?
I have no idea.
All right, so what did we see with that interaction? Too much information, way too fast. There was like barely a pause at all in that conversation. Quote unquote conversation. I'd say it's a one-way conversation. What else? Yes, dismissive behavior by the practitioner. Just assumed you knew all of those things and then see you next year. She didn't even, it's like she hardly even looked at them, right? Yeah, what else? Yeah, she used all these technical terms, bronchospasms, like this, we're talking about a presumably teenage boy. Like, he's probably not gonna know what those terms mean. So, exactly, we saw those technical terms, a lot of medical jargon, giving too much information too quickly, talking too fast, and asking yes or no questions. Why might we want to avoid, say, asking yes or no questions? Less pressure? We want to avoid it. Yeah. Yes, less pressure on the person asking. Is it easy for someone to just shake a head yes or shake the head no? How do you know if they understood it or if they really have considered questions? We don't. So that helps us kind of gauge where they're at. It's hard to understand, to see if people understood what you said. So especially when you're leaving it up just to an easy head shake, makes it more difficult to see if you've actually communicated clearly for them. And then we saw there was a lack of understanding. So what can follow from that? Misuse of the medication, absolutely, if he uses it, right? If you don't know how to use it, you might not even do it. What else? And what would that lead to if you're not using your medication or using it incorrectly? Yeah, you use it too much. Yeah. You can have medication error, lack of adherence, poor self-management. This is going to increase the use of emergency care or urgent care. You're gonna miss school. You could have the parents miss work because of that as well, which could lead to economic issues going forward. So what can we do? We can use our health literacy universal precautions. We need to use plain language in both verbal and written communication, and we want to ensure understanding by using a method called Teach Back. So when people typically understand that they have a hard time with communication during like a doctor or health visit. So they do certain things to protect themselves that can be a little frustrating for us as providers. They may walk out and become angry and demanding. People don't like to feel like they aren't intelligent or they're being belittled. They don't want to feel that way. So they may already have preconceptions about what's going to happen based on past experiences. They might make excuses or clown around, use humor to try to avoid certain topics or avoid showing that they don't understand. They could always bring another person to help them understand different information. They may just watch what other people are doing and try to copy that behavior. They might just be quiet and passive. They don't really give you a lot of response. They can detour and let you miss the concern. They may seek help only when the illness is incredibly advanced and then never ask for help. They don't want to seem helpless. They don't want to seem unintelligent. They don't want you to think lower of them. So how can we help prevent that just from the very get-go before we even start talking to someone? We can create what is called a shame-free environment, which is welcoming. Everyone's greeted with a smile. Help is offered proactively and sensitively. Questions are encouraged. There are signs and directions that clearly state where things are, especially in multiple languages if possible, so that people who have English as a second language can still navigate your systems. We want our electronic information to be easy to read and follow. This allows people to feel comfortable saying that they don't understand something. You are already welcoming. They already felt like they belong here, so they have more comfort to ask questions and say that they're not understanding something. And again, asking more questions, being comfortable asking those. And then talking openly about their health and concerns. So if you walked into a provider's office, let's say there's multiple providers within this space. You have multiple receptionist desks. You don't know where to go. Everyone's kind of glaring at you. Would you feel comfortable for your appointment? No, I see some head shakes. What if someone gives you kind of like an attitude, like, why are you here? What are you here for? No. Right. It can be as easy as just being more friendly, having a smile. I'm not saying I'm not smile more, kind of but to be welcoming and to be friendly, to notice if people aren't sure where to go, you can ask what's happening if they need assistance. Or, if you're in one of those kind of less than great moods, maybe we avoid the public areas and go through the basement. That's always what I suggest. So we're going to get into our health literacy universal precaution communication principles. So clear communication helps everyone because it's hard to tell by looking at someone if they do or don't understand something. And with this, our health literacy levels do not remain the same all the time. If you are sick or worried about a family member, spouse, friend that's sick, your health literacy level is not going to be the same. How many of us have experienced this? Yep, I have too, definitely. We are within the professional field of public health, so we have some understanding. But the moment things kind of start going downhill, you have that stress, anxiety, sickness, just give it to me clear. I just need the simple steps of what I need to do. I don't need all that extra, even if I could understand it on a typical day. Because again, only 12% of our population is proficient and can navigate our healthcare system well. So especially when those 12% of people are also sick, then we can see a very big decrease as well. So one of our health literacy best practices is using plain language. What is plain language? Plain language is clear. It only uses as many words as needed. So A lot of times when we think of health literacy, we want to try to get it as short as possible, which is true, but sometimes our big technical terms have to be broken up into multiple words, right? So I use hypertension as an example. That's going to be high blood pressure. Just because there's more words doesn't mean it's harder to read or listen to, because they're broken up into more simple words. This is not baby talk. This is a big one that I get asked about, is I don't want to sound condescending coming at someone. You're not. You're trying to get at their level. You're trying to have a conversation with someone. We're already put up on a pedestal, kind of, like as in the power dynamic, we're higher up as a provider, so we already are feeling that stress because of the difference in power dynamic. This can be just sitting down and talking to someone instead of standing over them. This is showing that you care about them because you want them to understand. You're not here belittling them. You're just speaking in a way that you would speak to your family who's not in public health or friends, and explaining that because you want them to understand, right? It lets people focus on the message instead of complex words. A lot of times when we're speaking, if you are using those technical terms a lot, people are getting hung up on that. They're like, I don't know what that means, and then they miss the whole rest of your message. Obviously, this does not replace complex terms among health professionals. You can speak to each other however you so choose, well, nicely and kindly in a professional manner. So it does not replace that. So I'm going to show you an example, and we're going to try to see when the deadline is for submitting your application electronically. So our first example, does this look fun? To try to figure out how to get that? You have to read it all the way through. What about this one? Which one would you rather have to find your electronic application? The second one. Yeah, they make it easy. They break it down. You have a little column that says electronically, and then it gives you the information. So now we're going to practice. We're going to reword the terms on the left into plain language on the right. So our first term is lactation. Breastfeeding, yep, similar. Making breast milk. What about postpartum? Yeah, afterbirth, yes. Yes, I bring this up because it's been brought up that a lot of times people associate just postpartum with postpartum depression, so they combine that term into postpartum. So this is just after the baby is born. And then initial, just first, start, depending on how you use it. Yes. And I actually have a bigger example, and if you want to take a screenshot of this, this is our plain language with WIC terms. So you can see on these, like gestation, often used when talking about pregnancy, just pregnant. We have, what's another good one on here that I think, latch, like how your baby attaches to your breast. These are terms that, we probably use all the time and think they're pretty common, and they probably are, but we don't know for sure if people understand what it means. All right, so we're going to go back to our little scenario. We're going to see the son and the father and our provider, and we're going to see her explain how to use the inhaler using plain language.
So Mac, you have something that we call exercise-induced asthma. That's what happens when you're doing a prolonged exercise, so to exercise for a long period of time, and then you start to feel short of breath. And that's because the muscles deep down in your lungs start to twitch. Fortunately, we have a medicine that's going to really help you with this, and I'm going to show that to you and your dad how to do it. And to make sure that I was clear, I'm going to explain it to you, and then I'm going to ask to make sure that you can explain it back to me so you know how to do it. I'm going to show both of you, but I'm going to really make sure you understand how to do it because I assume dad might not always be with you to practice to do this. And I'm going to show you it's going to take a few times of practice to learn how to do this just to make sure. So what I'll do first is want to make sure you don't have any questions about that.
No.
I'm going to send two things down to the pharmacy. One is called an inhaler and one is called a spacer. So you're going to pop this lid off. You're going to stick it in the spacer. Then you're going to pop this off. I'm not going to put it in my mouth here because this is just for me to show you how to do it, but you're going to put it in your mouth. You want to do this about 15 minutes before you start your exercise. You're going to give yourself a puff, but before you do that, you want to take a deep breath in and then blow all the way out. And then you're going to breathe in over about 5 to 10 seconds, hold it for 5 seconds, and breathe out. Then you're going to want to do that a couple of times, but you want to wait a few seconds in between, a little bit, about half a minute or so.
All right.
What other questions might you have?
I don't have any.
So what did we see, especially in comparison to that first interaction? She was sitting. Yeah, she got on their level, breaking up that power dynamic, right? What else? Did we hear bronchospasms this time? No. Yeah, she used plain language to explain his sports-induced asthma. So again, we saw her sitting down. She had a caring tone. We weren't, see you next year, throwing it away. She actually made eye contact. She looked at the patient. She focused on the teen as well. So that's really important. A lot of times we get caught up with, especially in like parent-child dynamic, we'll talk to the parents instead. We want to make sure we're focusing on the patient. Obviously, we're going to refer to the parents within the conversation, but we want to focus on who the patient is. This can be also applied to when using interpreters. So when we use interpreters, we want to make sure we are talking directly to the patient and saying exactly what we would say. We wouldn't turn to the interpreter and say, tell her blah, 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 right? Because what they're going to do is translate that directly. And that's going to come off very condescending and a little rude, right? So we want to focus on our patient. She slowed the pace. She says she's going to have him explain back to make sure she was clear. So she put that burden of understanding back on herself. And what I also liked, and why I like to redo this and rewatch these every so often, is that she said it would take a few times of practice to get it down. So again, less pressure just to know right off the rip on what to do. It's going to take a couple times, and that's okay. So now we're going to get into that teach back portion. So she explained it. Do we know if he understood that or not? Do we think he could use that inhaler potentially correctly? I mean, maybe, but do we know for sure? No, we don't. So how can we check for understanding? And teach back is a method that does exactly that. We want to check for understanding when we share information with others. With this concept, is that important to your work? Yeah, absolutely. If so, how is that important to the work that you do? Yeah, absolutely. We want to make sure they understand so they're actually following the directions and doing what needs to be done for their health. We also don't want to assume that they understand and things go wrong. Or, you know, it can save us time in the long run. It might seem like another step in your process, but when people have to continuously come back in, call, ask questions, it's going to add up that time over a period. So what is teach back? Teach back is asking people to explain in their own words what they need to do, know or do in a friendly way. Why is it important that you ask them to explain in their own words? Right. Anyone can regurgitate what you said back to them word for word. Doesn't mean they understand what the words mean. When you ask them to explain in their own words, you're getting that clear if they've understood or not, and not just a repeating of what you said. And it's important to do this in a friendly way because this is not a test of the patient, but a measure of how well you explain something. And I think that's one of the hardest parts of teach back, is because in our minds, we're like, I just want to make sure you understand and you can get what you need. But we got to rephrase that, and I want to make sure I did well explaining something. Can you teach back or tell me what we went over? Because that pressure then gets put back on you as a provider, and it's less pressure on your patient. And it's a way to check for understanding, and if they can't teach back, then it gives you the opportunity to re-explain to ensure that they do have understanding. And it's very important when we re-explain that we do it in a different way, Because obviously if they didn't get it the first time, you just repeating the same words over and over again is not gonna get through. And that's where we get to that condescending kind of attitude. So, for example, I want to be sure I explained everything well. Can you tell me in your own words what you will do so I can be sure I was clear? Teach back steps. There are only 3. They are pretty simple, but in practice can be very difficult. So, first, obviously we want to explain the information. 2, we want to check for understanding, asking for teach back. I want to make sure I explained everything well. Can you tell me what we went over today? And 3, re-explain in a different way if you need to. So what's the first step? Explain. What's the second step? Check. And what's the third step? Re-explain if needed. Good job, everyone. So some teach back examples are what you will tell someone else. I really like this one because typically people are going to go home and talk to their friends, their family about what happened at their appointment, right? So what will you tell your mother about her insurance, what her insurance will or will not cover? Can you go over it in your own words? This will help me know if I explained it well. How would you explain to your wife what medications you're going to be taking and when? Just so I can make sure I was clear. Behavioral changes. We've gone over a lot of information and a lot of ways you can get more exercise to help your diabetes. In your own words, can you go over what we talked about? How will you make it work for you at home? And follow-up. So this is a good point I like to bring up. It's not always on the provider. It's not only on the provider to do teach back. We're talking about receptionists, schedulers, other assistants within the room. So let's make sure the application paperwork gets handled right. Can you tell me what you will do with these forms and the deadline to turn them in? I know we have a follow-up appointment scheduled. I would like to just make sure we're all on the same page and we know what time you're going to come back. So I make sure I was clear with your appointment scheduling. So this can go, like I said, apply to more than just your provider. So with teachback, a lot of times we might have a lot of information that we're giving to people, and that's just really hard to expect them to teach back everything at the very end of your appointment. So with this, we're going to use a method called chunk and check, which is about breaking up that information into the 2 to 3 main points, checking for understanding, and then moving on. So for this example, we're talking about naloxone. We want to make sure that they were clear, and I want to ask you to go over key points in your own words for each thing we talked about. So, where will you store the kit? Explain, get that feedback, move on, or re-explain if needed. Then we go to the next subject. How do you know if someone's overdosing? Check, next subject. So we're breaking up that information into smaller, easier to digest chunks, checking for understanding and then moving on. And again, we want to be asking open-ended questions, not yes or no for each chunk and check. Because again, it's easy to just shake your head and not really understand if people got the message. Teachback is everyone's job. So again, we're talking about different paperwork and forms that may not be done by the provider. We're talking about, even finding your labs afterwards. So where did they go? How did they get that? Who's explaining that to them? And then we also insurance coverage. So even trying to help, patients get coverage for their medication. A lot of times it's prescription stuff that at least I've had issues with before. So how can your pharmacist help you through that as well? So now we're going back to our scenario, and we're going to see the provider ask for teachback.
So I just want to make sure that I'm explaining to both of you how to do this clearly. So I'm going to ask for you to show me and teach me or explain back to me how you're going to use the inhaler and the spacer.
So pretty fast. I just want to make sure that I was explaining everything clearly. Again, because who are we not testing? The patient, yep. We are ensuring that we are explaining something well. So, you're gonna ask them to show you or teach you or explain back to me just to make sure I did a good job. And you can always, I've heard people make comments like, you can say, we're implementing a new way to check for understanding. So I just need to make sure I'm doing a good job in my explanation, and this is what, so that they already are expecting it and they know it's not a test of them. Oh, you can always blame our organization for stuff like that, So, hey, this is a new process. I'd like to try it out, no pressure. So we're gonna see him not be able to teach back and see how we handle that situation.
So Mac, I wanted to just make sure that I was clear in explaining and showing you how to use these two things, the spacer and an inhaler. So could you take these and show me how you're gonna do this?
Yeah. So you take the cap off of both of them, and then you stick the inhaler in, this side. And then you puff it in, you breathe in, out pretty fast, and then you do that like 2 times in a row right before practice or working out to make sure everything's right.
Yeah. So I think I probably confused you on a couple things, so let me go over that one more time.
All right.
All right, what did we see? Absolutely, yeah. She took that responsibility for being confusing. She didn't blame him. She didn't get irritated and be like, oh, I guess I gotta explain this again. Yeah, she was like, I think I probably confused you. Let me go over this another time. But again, and then she asked in a way that isn't testing the patient. She wants to make sure she was clear. So, can you show me how to do this? So now we're going to see that re-explaining step and asking again for teach back.
So why don't we go over this one more time? All right, so you're gonna have both the inhaler or the puffer and the spacer. You're gonna take the lids off of both of them. Then first time you use it, you wanna do a couple puffs to get this thing going. Then you're gonna actually stick it into this end of the spacer. Then first thing you wanna do is take a good deep breath in, deep breath out. I'm not gonna do it for real this time, but you're gonna push down and then you're gonna breathe in slowly. So over about 5 seconds, then you're gonna hold it for 5 seconds and then breathe out. Then you're gonna wait about 30 seconds before you do the second puff. And you wanna make sure you do this about 15 minutes before exercise, not right before. So that way the medicine has time to get down into your lungs and work. Okay?
All right.
You wanna show me how you do it?
Yeah.
So why don't we go over this one more time? And then she re-explains differently. What I like in this example of what she did, especially with the timing, is she maintained the same measurements. So instead of saying half a minute, she said 30 seconds. And then once it got into like a higher, like 15 minutes, like then you can get into the minute. But you're not mixing those up. Half a minute, then 15 seconds, then, whatever, 120 seconds, stuff like that. She also emphasized some of those points that he had gotten wrong, right? And not in a condescending way, but just in a, to emphasize this portion. You want to go slowly, not quickly. She's going to focus on those techniques. She showed it a little bit more and explained it in a different way. So, and then she asked again, you want to show me how to do it? So now we're going to be able to see him teach that back.
So what you do is you take both caps off to begin with. Then you place the inhaler inside the spacer. You breathe in and out, and then you puff down, breathe in for 5 seconds, hold for 5 seconds, breathe out, and then you do that again in about 30 seconds. And then after that, you do that about 15 minutes before practice or before you work out.
That was really good. Do you think you have it down?
I think I do.
Good. What questions do you have, Dad?
I don't have any questions. Thanks.
Great. So here's a handout just in case you need a refresher when you're at home. I've highlighted some parts for you just about key points about how to use the inhaler. And then you guys can make sure you give us a call if you have any questions that come up while you're at home.
All right, thank you.
Thanks a lot. We'll see you guys next time.
Thank you.
All right. So what did we see in that interaction? He was able to teach back. What else? Confidence. Is that what? Yeah, absolutely. And she affirms that he did. Everyone loves a little praise here and there. So being genuinely excited for them is helpful, and that praise and being confident in what they do. She also asked open-ended questions. So what questions do you have? And she provided a handout with key points highlighted. Why is that important? Well, because our literacy rate's pretty low, as we've seen so far, and a lot of people don't want to have to dig through the different health information. So when you highlight the steps that they really need or the most important information on a sheet, it's helpful. They may actually use that and reference it. Especially with a lot of materials, it's very hard to read. They're typically at college grade levels. So if you haven't gone through all your materials and made them closer to about an 8th grade reading level, is what we try to focus on here at Columbus Public Health, then it's really important that you're highlighting that most important information, because to them it's just a page of a bunch of words, and that's a lot of stress and pressure to try to read through. She also said that they can call whenever if they have questions at home, not just leaving it up and feeling like they got it now, there's no further questions, and you're on your own. Any other things that we noticed within that? All right. So for using TeachBack well, for more than one topic, we want to chunk and check, which is teaching the 2 to 3 main points for the first topic, checking for understanding with TeachBack, and then going on to the next topic once they have that down. We want to support teaching with reader-friendly plain language materials, so our handouts. What would make something more reader-friendly plain language for materials? What could be helpful? Do you think only having words on the page would be incredibly helpful for our written material? No. So what else could we use on there? Oh. It could. I mean, you're not wrong. But again, she didn't completely overlook Dad. We want to focus on the patient. That's the biggest key. Yeah, Dad could teach back as well in case he needs it, but most likely, do you think Dad's going to be with him before sport practice? Okay, I mean, that's great if they are. In my experience, I did not have my parents at all at any sports practice ever. But again, you have a good point though. If they are their support person, it could be helpful to have them teach back as well. But again, we want to focus on that patient. Anyway, with plain language friendly material, we want to make sure there are pictures. If you're going to have charts, make sure they're easy to read. Charts and maps can be very difficult for people. So having pictures explain the steps and stuff and having it in order by step is very helpful. We want to use TeachBack for all key education and communication. So if you're communicating something with someone that they need to understand that information, you should be using TeachBack. We want to document the use of and response to TeachBack. That'll help us engage better and know that we're doing the best we can. So what are some reasons people might be unable to teach back? And again, this comes with that shame-free environment, the fact that people that already have lower health literacy are pretty aware of that and are already stressed and anxious coming into the appointment in the first place. A lot of times we'll see that people will forget whether on purpose or on accident, the glasses, hearing aids, and other assistive devices. Because then there's an excuse, right? There's an excuse to say you don't understand. Oh, I can't hear you very well because my hearing aid died. Or, oh, I can't read that right now because I have glasses, I'll have to wait till I get home. They also may include a lot of family members or friends too, so being aware of that. Again, sometimes, depending on the situation and what you're talking about, it can be very helpful to have friends and family with you. A lot of times they know how to explain certain things well. However, in some circumstances, especially when there's a language barrier, children and family members should not be that person interpreting for them. There's a lot of mishaps that can happen within that. A lot of times, especially when we're talking about kids, they don't necessarily know the medical terms the same way or how to explain that to the parent. Or it could be very personal stuff like reproductive health that they're not going to want to talk to them. So you can get this misunderstanding of what exactly is going on because that translation's lost. Or we also have potential of having secrets be shared that they don't want to. We're talking about sexual health. Maybe there is an issue with an STI. We don't necessarily want your friend to know that you have an STI to share with whoever else is in your family circle or your social circle. We want to check for language, literacy, and cultural barriers. So if we know that we're going to need interpretation services ahead of time, already having that scheduled so it's ready to go instead of being a last minute thing. A lot of times we don't necessarily always have that information. It can be last minute, but doing our best to ensure that we promote that we have interpretation services, that they are professional interpretation services, and they're there to help. Because again, we have some distrust in the system, so ensuring that they know these are professionals here to help and follow all the HIPAA guidelines and things. Cultural barriers, this could be literally a difference between shaking people's hands and not. There are some cultures where you don't touch the other opposite sex or gender, whatever they're presenting out, their gender, you don't typically touch them. So that could be something to keep in mind. So if you have certain clients that you know are in certain demographics or populations that don't do that, being respectful. And again, you're gonna make cultural mishaps. That happens to everyone, but learning and growing from that, and kind of a plug, because we have a lot of cultural humility trainings this month for Minority Health Month. I highly recommend going to them to kind of have a better understanding of different populations and their cultural aspects. We can always, if we are unable to teach back, we can always ask another health team member to help. Maybe they can explain it a little differently. Maybe they look more similar to the person that you're talking to or have a similar background to them, so they can explain it in a way that makes sense. I'm always hesitant to promote scheduling another visit or call because a lot of times our clients are not able to just come out whenever. They're working, they have transportation issues. So some of that can be very difficult, just making sure that they are able to do that if you have to. But I would leave that as a more of a last resort type thing. And pass along for extra help. This is how I interpret, if you had I wouldn't say bad, but a negative interaction and you just were not clicking with someone, take that back to your team. Do some role play. See what you can do. See what their experiences are so that because it's most likely going to happen again in the future, you're ready and prepared. You're not kind of left out in the desert waiting for some miracle to happen. So our interpersonal communication takeaways, our health literacy universal precautions is to use clear communication with every single person you meet. So you may know that they have a high education background, you still want to be using these techniques. Teach back, plain language. We don't know what their background necessarily in. So they might not be a health professional, they might not have that background specifically, but they could be a professor for history and have a lot of other knowledge. This is because anyone can have trouble understanding health information, especially if they are sick or worried. Again, we're not stagnant in that health literacy level. It changes throughout our lives and it changes based on the situation. We want to use clear communication words and tools with everyone. So we want to use that plain language. We want to speak in living language talk. We want to make sure we are using materials that are not super wordy and have pictures and step-by-step instructions and highlighting key information. And we want to use teach back, which again is asking for people to explain in their own words what they need to know or do in a friendly way. It's not a test of the patient, but a measure of how well you explain something. And it's a way to check for understanding, and if needed, re-explain and then check again. So with that teach back point, we are actually going to get into those scenarios now. So I will ask for someone to volunteer to be our provider and someone to be our client. So our first scenario, we are going to be speaking with a community member about the ABCs of safe sleep. Explain the ABCs of safe sleep to the client and end by asking for teach back. So what are the teach back steps again? Explain. Check. And then re-explain if needed. Awesome. Another round of applause. We're going to get into our next scenario. So for this one, we have a client scheduling an appointment with our car seat program. The appointment's Thursday, April 23rd, 2026 at 1:30 p.m. They must park in the back parking lot in the designated car seat parking spaces and call the number on the sign to let us know they have arrived for their appointment. So we're going to ensure the client knows all of this information about their appointment when it is in the check-in process by asking for teach back. We are referring a community member to a vaccine clinic that occurs from noon to 7 p.m. on the third Thursday of every month at the health department. At this clinic, all vaccines are free. I know they're not usually, but for this, we're going to say they're free and make it simple. And we're going to share this information with the community. We're going to ensure for understanding by asking for teach back. All right, so we're towards the end of our training. What is one step you can take after today's training? What methods could you use? What thing could you apply to your job that is one takeaway from today? Use simpler language, yeah. What else? What was it? Chunk and check. Yes, absolutely. That's a great method. Even just creating that shame-free environment, being friendly, being open, smiling, having that connection. What questions do you have for me? And if you don't, there's a, yeah. Yes.
Oh, thank you.
Absolutely.
Like, should I be doing this with any age?
Yes, absolutely. I actually bring this up because I have kiddos in my care, and I use this kind of stuff. It's not as formal as teach back, but you're like, what time do you have to be home again? Tell me. And it's as simple, and obviously not authoritative like a parent would be, but yeah, you just change up a little bit and ask those more, I would be more guided in your question asking, not just explain all this back to me, but explain to me how you use this if you're teaching them how to use something, or show me how to do that. And then it's think of chunk and check, but very much just the one topic. So yeah, I would say absolutely. Very helpful. And it shows you care about them as a person and not just seeing them, because a lot of times children get seen as subhuman, right? So that would definitely bring that up and be more inviting for them. Mm-hmm. Hi.
About resources, just in case people are interested in looking at the language they use with clients. Do you have a list of health words that are broken down already?
We don't, but that's a really good suggestion to have. If you have materials already, we do have a process through REDCap that you can submit them for a health literacy review, and then I can help give those examples or rewrite stuff as well. But even if you, maybe there is a list of words that you typically use, if you want, you can just shoot me an email and ask and I can try to help wordsmith it too and stuff. or even bring up a training for that specifically for your section.
Awesome, thank you.
Yeah. Any other questions? If not, we have your question, comment, QR code at the end here, I think. Before we get into your gold medal, I have a favor to ask. If you could do our post survey, it'll just take a few minutes. I have the QR code